Hello, everyone. Welcome to Health Commune, a space where medical conversations are made simple, relatable, and easy to understand. Here, we break down complex health topics with the help of trusted medical experts without any fear or jargon. In today's episode, we are breaking down the biggest fears and misconceptions around brain and spine surgery. We'll talk about when surgery is actually needed and when it isn't, what real alternatives exist, what modern medicine can do with far less risks than before, and what recovery truly looks like in real life. No dramatics, no internet buzz, just pure expert advice. For that, we have Dr. Tejesh Shavi, an expert in the field of neurosurgery with more than 8 years of experience. He is currently associated with Prakriya Hospitals in Bengaluru as a consultant interventional neurosurgeon. Welcome to Health Commune, Dr. Tejesh.
Hi, Aditi. Thanks for having me here for the session.
My first question would be when people hear the words brain or spine surgery, it's a fear comes. I've seen that even in my family, there has been one such case. Now, why do you think that as soon as people get to hear about the spine or neurosurgery, it's the scare or the fear that is the first thing that comes to their mind?
It's very natural. In fact, I would say, being a neurosurgeon myself, educate people, or rather kind of tell them, that they should be the last ones visiting me, in fact. So the nerves are in your brain, the nerves are in your spinal cord, the nerves are in your peripheral, your limbs. The nerves are controlling every aspect of your body. So somehow I feel that neurosurgery is, kind of associated with your own personality. So people kind of feel that, the nervous system is basically their own consciousness. So when you kind of, talk about operating on their nervous system, it's not just some particular part of their body that they're relating to. It's their entire entity as a whole. They feel that it's a very intimate relationship when they talk about themselves and getting an surgery done to their brain or their spine. They feel that it's a part or mainly their entirety where we are operating upon.
So, Dr. Tejesh, then do you think that probably comforting the patient or telling them exactly about their conditions helps ease those nerves or get rid of some of that fear that they come with?
Yeah, being a surgeon, what I feel is, and especially a neurosurgeon, I think it's very important that you first make them sit, make them feel comfortable in your cabin, okay, and then try to get in as many family members as possible along with the patient, so that that kind of a tension, that kind of an aura that is created there whenever you talk about surgery, that is kind of shared, between people. I think the skill of making the patient feel comfortable in your hands is something that usually develops with time and experience.
So then, doctor, is it like when patients come visit you, they're convinced that surgery means everything will change in their life, permanent change, and it's some kind of myth that can be busted, or is it like a fear, more of a fear that they come with, which can then be changed with, you know, giving them the right guidance, or sympathizing with them, making them comfortable.
Yeah,
So,
I get your question. So yeah, like I told, I would not say that a majority of the patients come with that kind of preconceived notion that neurosurgery is difficult. Why would I undergo something like this? At this point of time and stuff like that. I would not say that because most of them usually come. See, in a population of patients, I would say probably 80-90% would just come in. Try to honestly get a opinion from you, and see where it leads to forward. Not come in convinced that yes, I'll go ahead with the surgery. And as a surgeon, I would not expect the patient also to agree to me immediately. I would not, rather. I'm actually quite comfortable with the patient listening to me carefully, as long as he listens and understands what I say, and try to get the gist of what I'm trying to say and the importance of what I'm saying. And then if he's happy to go around, asking, can I get a second opinion? Can I probably take some time and, decide? Of course, depending on the urgency of the situation, I would definitely recommend that. Yes, absolutely. And that would, in fact, be supportive for a surgeon also. that your patient would go to another place, and that would in fact bring in more confidence to the patient, that he's going to come back to me, and he believes that what I've told is for his good. I would definitely encourage that kind of a thing. And yeah, as patients, I would hardly say 20-30% would come with that kind of a fear first itself, and hardly these days you have patients, looking at other people and trying to, feel that, it's not safe or stuff like that. No, I think there's a lot of awareness these days, and that's picking up, but of course, yeah, neurosurgery is the last. It's always been the victim for awareness, but I think people are kind of open-minded these days, and they don't immediately start fearing surgeries. I feel I've seen that in the real world. I
Definitely.
don't think it's been like they start crying, they start feeling losing hope. No,
It's
it's
not
it's
like
not
the
like that.
movies.
No,
Yeah.
no, and movies are too dramatized when it comes to neurosurgery. No.
Yeah, sure. Doctor, one of the biggest questions that even I've heard is, doctor, is surgery really necessary? Now, how do you approach this decision? Is it like, do you look at some kind of, if the age of the person, or I don't know, the financial condition of the problem, or what other things do you look
Yeah,
at?
a lot of these aspects play into the decision making, but the most important one being, of course, the condition of the patient. When they ask me this question, is surgery really necessary? I would say the question is wrong. Okay, so surgery is definitely necessary, but the question would be, when is the surgery necessary, rather than the surgery itself being necessary or not. Now, the necessity of the surgery would be based on he taking a decision at the right time or not. As a doctor or as a surgeon, my role would be to guide the patient as to what is the urgency of the situation, whether he can take time to decide and to get back for surgery, or does he need to do it immediately as an emergency. But whether he needs a surgery or not is, of course, depending on the thing. But I don't think any doctor these days would advise something that was not completely indicated, right? And as a surgeon, as a neurosurgeon, I think it's our highest responsibility towards the patient to give them the right guidance when it comes to getting operated. You will not operate a patient for unnecessarily, but you would operate a patient depending on the necessity of the time. Correct. So as long as the patient understands that yes, there is a need for surgery, but the delay of surgery can only mean worsening of things. Yeah, because when you can manage something with medicines, doesn't mean that you can avoid surgery if it is an operative case. You're only just buying more time, but at the same time, you should understand that medicines are not going to regenerate those parts which are continuously getting damaged internally. Yeah. So medicines are there to just treat the symptoms, not the root cause. And the root cause can be treated only surgically. There are no medicines in the world can go and treat the root cause of the problems. So when you're just masking the symptoms with medicines, you're just delaying the damage even further. And that's going to make the outcomes post surgery even harder for the patient. So, it's as a surgeon, it's my responsibility to explain that to the patient in the right way so that he understands that. When I say, yes, you take all the time in the world and get back to me probably 10 years from now, I don't think I'm doing the right job. Yeah.
Yes.
He should understand that no, with time, the things are getting, I mean, even worse with time. And, I should probably decide and come back quicker. When the doctor has told me that it has to get operated, there is a reason for that. And, I should get that done as early as possible. And
Right.
an emergency is an emergency. That situation is entirely different. You don't have time for that. It's a life saving surgery, and there's nothing. There's no debate about that.
Right. Doctor, now this brings me to two questions. Like,
Yeah.
how frequent or not so frequent are cases where probably medicine can work and surgery might not be required?
Yeah.
And then another part is, so these days Google and all these websites, they are very prevalent. So patients do a lot of googling before coming to doctors. So have
Correct.
you also had such situations where the patient was convinced by reading whatever material that yes, I'll be needing a surgery, but then that has not been the case?
Aditi, thanks for that question. Actually, I really was waiting for this. See, when I'll tell you one thing, when patients Google, or these days a lot of AI being into
Yeah.
play, and with very easy information on their fingertips, for me as a surgeon, it becomes very easy to explain, right? And they would already know all the information beforehand,
Okay.
so that makes my job easier for them. I would just tell them, yeah, it has to be operated. It has to be operated. See, there's a huge gap between technology, Google, AI, and a clinician telling you things, enlightening you, whatever. Even if the information is overlapping, even if the information is same, that kind of an interaction between a doctor and a patient is completely different as compared to accessing, resources online.
Right. I'd like to ask a bit more regarding this Google and all these
Mm.
AI related
Yeah,
things that are already available. So, what do you do when people come to you so anxious? Because it's more scary out there than, I mean,
yeah,
reassuring.
correct, correct.
Whenever you read all these things, and
Yes,
most of it, because we, as laymen, we do not understand all those critical medical things. So it's like very daunting for us when we look at
yeah.
all these information on the thing, and then when we go to the doctor we are already anxious. So how do you then tackle such kind of a situation?
Yeah. See, first thing I would do is when a patient comes to me with so and so stuffs, telling that, I had these kind of mild symptoms, and then when I read about them online, I found out that the cause could be so and so, and that kept me even more worrisome. I've lost sleep since then. I've not been sleeping properly in the night because of that, and I just want to come to you and ask you what could be done. Could I get an MRI? Could I get a CT? What do I do about it? I think that's good. So when they come to us and they ask us, most of the times 90% would be exaggerated, right? So when they do that, yeah, I think we just tell them, these kinds of, kind of reassure them that, some things, I would say 10% would be something that you really need to worry about, and the remaining 90% is something that you tell them it's fine. Just don't worry, don't bother.
Right. This actually brings me to my next question. So, how important is getting a second opinion in
It is, it is.
neurosurgical cases?
I
Like,
I'm completely,
even
yeah.
for both for the patients as well as the doctors.
Absolutely, absolutely, 100%. I agree. I'm completely for patients going in and getting them getting their own doubts cleared by another clinician of my own stature, or of my own department, or anyone for that matter. If not, I'd rather give them ideas to go and do that. Because I think it instills a lot of confidence in them to go about with the further treatment. When they seek second opinion, I think they just want to seek answers like surgery is not needed at this point. We can try medicines. It's a big responsibility for the doctor who's giving the second opinion, one thing. And also, as a patient, you shouldn't be willing to go and seek no surgery as an answer, right? You should not be keep looking for a non-surgical solution to things. When somebody says yes, surgery is needed, non-surgical answers are something that people look forward to as second
Yes.
and third opinions, and but I don't think that actively seeking that is the right thing from the patient's perspective.
Okay.
They would go around shopping, trying to look for the answers that they want to hear, but that's only delaying, things, and it's only going to get worse and worse. I've had patients coming to me probably 6 months later, 8 months later, coming and tell me, sir, yes, I
Oh,
think let's go ahead with surgery now. But then you're lost that 8 months of golden period where, every day you've been, on a daily basis, you're causing a lot of damage internally to your nerves. It's very important that, they get convinced immediately by a second or a third opinion physician.
right. So, Dr. Tejesh, for a person who is like coming to you for the first time, and you explain how the recovery process would look like, and because generally people have this fear that it could lead to paralysis, memory loss, because as you when you started you say that it's basically nerves, the most intricate part. First of all, in regular cases, how does this recovery process look like, and then how convinced are the patients that yes, I'll be able to come back to a normal life post neurosurgery?
See, that's a huge stigma that they feel that when it comes to neurosurgery, they feel that they're losing a part of themselves, and it's life is never going to be the same post surgery. I think 95% of the cases these days, with all the advanced technology that we have at our disposal, 95% of the case, I would say, I'm kind of very eager to say 97, but let's just play on the safer side and say 95% of the cases these days can be safely tackled with no disturbance to their quality of life as compared to pre-surgery and post-surgery. Of course, it depends on the complexity of the case that we're dealing with. A lot of it depends on the case, of course, but we have all the tools necessary these days to make sure that they are the same how they are pre-op as compared to post-surgery. Yeah, and this kind of a thing that they feel that no, especially when you operate the spine, they feel that they're going to lose a limb or two, they're going to be paralyzed. These are all stories that have been conveyed since the olden ages, where they didn't have modern tech back then. It's a completely whole new world, and that kind of an awareness is not being spread, of course, because neurosurgeons are too busy these days, to kind of get onto social media to do a lot of crazy stuff. But yes, I think um, yeah, the stigma with neurosurgery has to be broken. It has to be brought out. Yeah.
Yes, because the fear is still there. But
Yes.
then,
Yes.
with all these advancements in technology and medicine these days, yeah, it should reduce their fear.
Yes. Yes.
So, Dr. Tejesh, now it's very important to, get diagnosed at the right time,
Yes.
because then it helps with that entire journey. Any symptoms that you think a person should never ignore, or get a consultation as soon as possible? Because a lot of times what happens with us is it's like, okay, I'll just take a painkiller or something and get going with
Yeah.
that.
Yeah.
So what are those symptoms you?
Speech problems, memory problems, something known as seizures. Yeah. All these are symptoms when it comes to the brain. Something that has to be imaged. Your brain has to be scanned. Those kind of scenarios. And of course, when we're talking about the spine, it's all about back pain, neck pain, and a lot of pains in the night while sleeping, having a lot of numbness, tingling sensation in your arms, bladder control. All these are some things that you have to keep a watch out for. All these are nerve related, and something that you should probably get a consultation, at least if not an imaging, at least a consult is something that it warrants.
Sure, doctor. One last closing question. So, actually, I come from an AI background. So, one question: how is AI into neurosurgery these days? Is it helping you? Is it like how is the AI landscape in neurosurgery?
AI landscape, rather than how, I think it's just a matter of time before AI just delves into neuro completely. Yeah. I think we have a lot of potential to be tapped into, especially when it comes to AI. We already have a lot of AI being used into the detection of acute strokes.
Okay.
Yeah. And getting them to the right centers, to the right doctors who treat acute stroke, because stroke is a disease that can be reversed
Okay.
in the right time of frame. If they come within a few minutes or a few hours, and you reach the right person, the right doctor who treats strokes, you're going to be walking back home, you're going to
Wow.
be talking like how you were earlier. So all these, when we have all this kind of technology, AI definitely is going to help the patients reach the right person
Mm,
sooner. And because clinicians treating strokes these days are very, very few. you
mm,
know so AI into stroke is big time. AI into intra-op mapping, intra-op imaging, you know intraoperative guidance of surgeries is the next AI thing, yeah, that is being majorly developed these days. A lot of adjuncts to surgeries. You have a lot of guidance systems when you're operating live.
Mm,
There's always evolution when it comes to surgeries. So
right.
yeah, I think AI is playing a huge role into that and will definitely play.
Thank you, Dr. Tejesh.
Thank you.
Message for our viewers that spine and brain surgeries have become a lot safer. Doctors have got a lot of technology at their disposal. So, I hope we were able to bust some myths today. It was an absolute pleasure having you, Dr. Tejesh, on our platform. Thank you for being here with us.
Thank you. Thank you. Thank you, Aditi.